Good morning. Let me look at my webcam. Hi, folks. You're welcome to the Rural Good Health Foundation and Think Tank Entrepreneurs webcast. My name is Jojo Paro, and then I will be talking about the systemic lupus erythromatosis. We sometimes call it the SLE. The systemic lupus erythromatosis, it's a chronic autoimmune disease. The immune system attacks itself. And symptoms of this are seen by the severe fatigue, the joint pain, as well as the headache, the rash that appears on the cheek, butterfly rash, even on the nose. Anemia will be noted, as well as the blood clotting problems. The hair loss, as well as finger tinning. The person experiences tingling on the fingers when it's cold, as well as the ulcers, which actually can be noted on the mouth and on the nose. My good listeners, it's very wise and then for us to have a knowledge of what causes this, and the exact knowledge is not known. Then the factors that actually are linked are genetic. Family members with the other autoimmune diseases are linked to this. And then they also take one genetic loci when we do genomics linked to this as well. And that is to say, further research is needed. That's why I personally, I am in the new era of interest in genomic science, next generation sequencing. That's my area of research from now. I'm trying to open up. They say we have got 1,000 talents in heaven, and we've got 1,000 files. So now this is my first avenue to open the remaining files in the decades of my life. So I'm interested in genomic science, next generation sequencing, especially for rare disease, for oncology, as well as for personalized medicine. So now environmental factors are also linked, such as violet light, X-ray, and viruses are also linked to SLE. Coxsackie virus, yes, it causes autoimmune disease, especially in diabetes. And then HIV, COVID, we're living in the COVID era. So we should also take note of that. If we have had SARS, COVID-2, and living in the episodes of cancer outbreaks, then we have to link all this through research and innovation. We also link physical stress as well and emotional stress. If we've got elevated stress hormones versus the happiness hormones that we know, oxytocin, endorphin, dopamine, serotonin, then they also trigger elevation of the cortisol and then all the other stress hormones. So we're also linking them Mostly SLE affects women. So we also link this to high estrogen levels, sex hormones that they really affect women. And now we see severe symptoms in pregnancy as well. So as we also want to find the solution, we should be a solution-based community. Laboratory medicine, it's a frontier. It's a fact factory. In antiquity, the human capital development base that was here was able to diagnose the SLE. Basically, um, the diagnosis will be clinical first, and clinical by the doctor and nurse. They will do the physical examination, do all the blood pressure tests, blood glucose, check all the vital signs, and then look for the butterfly, the rash on patches, check for ulcer in the mouth, and then in the nose as well. And then do some check for arthritis, small joint swelling, hands on the hands, and then also on the knees and the feet. We should keep note that they need to do the differential diagnosis between other things like hemophilia and then arthritis. So now the signs of cardiac, irregular heartbeats, and then the lungs, they actually do the complete check. Awareness should be in place for the human resource base. And the fact factory, the laboratory, medical laboratory, should be meant, should be have the human capital of people who are able to do the diagnosis. Behind every sample lies the life of a patient. Should be competent, licensed, and then should have done medical laboratory science in full portfolio, and then have done hands-on in running all the tests. We'll be running ESR, erythrocyte sedimentation rate. They will be running the full blood count. They will be checking for LE cells. The LE cells are being done. It's an anti-DNA antibody test that we used to run as early as late 80s, yes, early 90s, because there was a cognizance that these things exist. And we used to have cases, yes, but they were not as alarming as they are now. Early cell test, check for the CRP, C-reactive protein for complement, check for urinalysis, you check for the X-ray, anti-nuclear antibody testing. And now when you do the rest, you should also consider the full um, blood sugar test, consider other clinical chemistry tests. That's why you need polyvalent medical laboratory scientists who will be also feature, do the microbiology, checking for infection, will be in hematology, checking for the full blood count, the ESR, differential count, find them in chemical pathology, and round up in microbiology. So we need the kind of the human capital development that is able to help with the patient diagnosis. Now, because this is a systemic thing, we have got a multi-system complication where we can have thrombosis, deep vein thrombosis. We can have blood clots. If there's clotting, we should also know that it can also be blocking the heart valves, can have a heart attack, can have stroke, peripheral neuropathy. It can also have the neuropathy that also have the memory changes in your head, seizures. Um, in Sesotho, we call them twatwa. Well, kidney failure, can have lung pruritus. Joint deformity will be a thing, and mental health problems, even eye problems. So it is very paramount that we have treatment. There should be policies on this rare disease, policies on lupus. Royal Good Foundation is running the advocacy on lupus as a rare disease and other rare diseases. However, since we are going to mount advocacy and then um, innovation research on this, we making advocacy that there should be some policies, some strategic plans which are linked to the non-communicable diseases, linked to cancer control, comprehensive cancer control strategy. We have implementation framework, have multi-sectoral play, because but we can pick some of our cases in early childhood centers, initiation schools, and places. Every ministry, everybody has to have a role. Some of these people are being hidden. So now the mode of treatment basically is ease of symptoms, anti-inflammatory medication like for joint and knees. As a medical scientist, you have the medical background, the knowledge of the signs and symptoms. Now you do the portfolio analysis in the lab. That's why it's called medical laboratory science. We need people with knowledge of the pathophysiology, the anatomy, the pathology behind the etiology, um, decision science of the epidemiology, as we call it now. We used to call it decision science because with all the principles that you are using, the Pareto, the decision tree analysis, computer simulation, and all those linear programming, the graphics and the statistics that you are using there, it helps you even in finance and financial management systems. So in medicine, in public health, we call this epidemiology. We're looking at the trends of diseases. You peg them by the population and cross-sectioning them into a different loci. So now the other treatment modality will be uh, steroid creams. Like I am interested in next generation sequencing. That is to say, I am advocating for the availability of the gene therapy, personalized medical treatment, gene modification, and gene expression of cytokines to be seen because they are also linked to these. So now, mainly the whole aim is to lower this reactive protein. Sometimes nutrition plays a major role, nutrition therapy. Really, it's very important that we talk about this in the platform of advocacy, inclusiveness of the policies, the outreach programs, because some of these people they are in the hard to reach areas. We need funding for that so that we are able to reach the hard to reach areas, household. Though did you know gram screening program, ask questions, look for the signs and the symptoms, and then do the laboratory testing. Some C-reactive proteins and then rheumatoid arthritis that tests. Their point of care there can be done by simple laboratory practitioner. They don't need a high specialized throughput national reference laboratories. Can even do them on roadside. SLE, we used to do like early tests and anti-nuclear antibody reaction test. We used to do that. I think now the only recommendation I can make on behalf of the Rural Guria Foundation and the think tank entrepreneurs is that we be given the capacity to capacitate the new human capital base that we have. There is a generation gap. How best are we dispensing our services to the patients in the era that we are living in? However, for more information, you can contact us at www.thinktankent.com. We thank you for listening. Thank you very much. Be part of the solution with us as we are calling all the other organizations and the policymakers, political leaders, community leaders, schools, churches, chiefs, for proper community engagement so that we combat this disease. Thank you very much.